Bluff Plantation's a unique location. And we've got 170 plus acres on the Savannah River, set in rural Georgia, and it truly is appropriately named. It is on a high bluff, looks down about a mile to the Savannah River over old growth pine and cypress. It's a beautiful place, but it has a unique history. The original buildings here, the main house and the cottages, were built as an executive retreat for an international corporation, and they brought their best and brightest here to so they could be isolated from the rest of the world and really be creative. I think that feeling still exists here. This place is a place that when people come out here, whether they're working here, whether they're visitors, whether they're patients or families, I think as soon as they pull up at the front of the building, they can feel it. It's a healing place. Well, for a number of years, the American Society of Addiction Medicine has said that addiction is a chronic medical condition. It's a disease, brain disease, and that's been given lip service in a lot of treatment areas. At Bluff Plantation and throughout the Rivermen system, we take that very seriously, and our model is a medically driven model. Of course, I couldn't do what I do without an entire team approach with all the nurses and therapists and counselors and recovery coaches and even our chefs. We have to do a team approach, but it's a medically driven model, and the patients here see a doctor almost every day. And that's really unusual in, I think, most treatment centers. Addiction is a chronic brain disease, and we have to treat it as such. We can't treat it like an acute illness, and that's, I think, one of the failings of treatment in this country in the past 20 years is, for a long time, patients were diagnosed with a addictive disorder and were pigeonholed into 28-day treatment programs. Some of them didn't need 28 days. Some of them needed a lot more than 28 days, but that's what they got. And when they left, they were, if not told, were given the implication that they had been cured and go forth and sin no more. And this isn't about being weak-willed, morally bankrupt, crazy, dumb, or stupid. This is about having your brain hijacked by drugs. And if we're able to treat this like the chronic illness that it is, then the patients are going to need to continue to do maintenance therapy just like a diabetic does to maintain their blood sugars and maintain their disease of addiction in remission. Just being abstinent from drugs and alcohol doesn't mean you're going to have a happy, healthy life. And so here we look at the whole person. We utilize a low glycemic index diet that's been shown to increase dopamine levels in the brain. We have daily yoga, which promotes mindfulness and really learning to live in the moment. We have a very strong exercise program, exercise physiologist that does individual and group exercise daily with the patients. So we have we want our patients, and I tell all the patients, specifically, there's no point in being abstinent from drugs if you're going to be miserable, unhappy, and unhealthy. That when they leave here, we want them to be well on the road to long-term recovery, which for us means not just abstinence from drugs and alcohol, but being overall in better health and continuing to improve their overall health, as well as really learning to be connected to our environment and really be citizens of the world. Rivermen Health and Bluff Plantation have a legal affiliation with the Medical College of Georgia at Georgia Regents University, and Medical College of Georgia is the 13th oldest medical school in the country. We train more doctors than anybody in the state, and we have every specialty that we could possibly need. And patients with addiction don't just have drug and alcohol problems. They have other co-occurring psychiatric problems as the rule rather than the exception. They also have multiple medical problems, some of them directly related to their addiction, others that they just have, like hypertension or diabetes, that have to be managed. And the beauty of our affiliation is we have access to the full power and technology of that fabulous teaching hospital that's just 15 miles away. Our patients that come to us initially that are entering into our phase 1 program, which is really a comprehensive assessment, evaluation of their addiction and their other conditions, both psychiatric and medical, as well as stabilization and withdrawal management when they need it. We have a unit in the main hospital, on the 3rd floor of the main hospital. And if we have a patient that's been injecting IV heroin and we feel they may have bacterial endocarditis, I need a cardiologist to see them. I send a consultant. The cardiologists are there to see the patient that afternoon. Same thing if we have a patient that's been smoking methamphetamine and their brain's not working well. If we need a neurologist to come see them. We have an alcoholic whose liver is failing. We can have the hepatologist, the GI specialist come see them that day. I've worked at a number of other places, and when you have a freestanding detox center or a freestanding psychiatric hospital where you're doing that kind of phase 1 care of the patient, you can't get those specialists to come see them. You call those specialists and they're busy. They tell you, yeah, I'll make an appointment to see them in my office in 4 to 6 weeks. That doesn't do the patient or me any good in getting them ready to be able to do the treatment they need to get long-term recovery. I think the most important thing that I would want anybody that's considering coming or a family member that was considering getting their loved one treatment here, I think they need to know that first and foremost, their safety is our priority. Everybody here, all of our team, puts the patient's safety first, and we want them not just to do well in treatment while they're here with us, but we want them to achieve lifelong recovery, which is possible with the right treatment and the right continuing maintenance of their therapy.